Namaskar. Good evening to everybody. At the outset, I pay my gratitude and thanks to the organizer for giving me the opportunity to pay my tributes to a legendary homeopathic physician of our country, rather internationally acclaimed homeopathic physician, most respected Dr J N Kanjilal, on his 113th birth anniversary. Really, it's my pleasure and privilege to share my experience on the auspicious day to commemorate Revered Dr J N Kanjilal. My today's topic is calcareous sulp, an applied aspect. In other words, you may entitle it as practicability of calcareous sulp. You all know calcareous sulp is one of the Schussler's so-called tissue remedies. Schussler himself introduced this remedy, and initially this medicine was proved in lower potency up to 12x. But while Herring compiled it from proving records in 1873, he took the extracts of proving specially with 30th and 200 potency. If we go through Allen's encyclopedia, where specially homeopathic proving is being incorporated, we will get the most of the symptoms of mental levels in calcareous sulp developed within 20 to 50 days during proving. Most of the symptoms developed in physical level within 2nd to 15th day. Most of the skin symptoms developed within 7th to 15th days. A few symptoms appeared even after 32 days. From this perspective, we safely conclude or consider this medicine as one of the deep-acting remedy. Proving symptom and verified clinical symptoms are the main source of this medicine, whatever we are getting in different mathematica. One of the great stalwarts and followers of Master Hahnemann, Dr. J.T. Kent, wrote in his Mathematica, he had been used first this medicine in 12 potency, but later he used in 30th and 200 and higher also. Kent said, quote, "From all of these many valuable symptoms have been obtained. Some of these symptoms have come out upon the sick while under the influence of this remedy and have been since confirmed, so that the following symptom must now furnish the best basis that we have to prescribe on," unquote. From this assertion, we are also getting more confidence to prescribe calcareous sulp as a homeopathic deep-acting anti-miasmatic constitutional remedy. If we consider the adaptability of calcareous sulp, mostly patients, those who are under the influence of psoric miasm or tubercular diathesis, may require calcareous sulp. If we consider causation from physical level, in few Mathematica books it has been written, onanism and sexual excess may cause weakness and development of few symptoms favoring calcarea sulp. Actually, calcarea sulp deserves its reputation, especially as a curative remedy in suppuration at the stage in which matter is discharging or continue to ooze after the infiltrated place have discharged their contents of pus. Whenever, along with pus, the necrosed tissue of the affected part is also being discharged, after that oozing continues, in those cases, calcarea sulp having the special affinity and works as a curative remedy. All ailments in which the process of discharge continues too long and the suppuration is affecting the epithelial tissue, in those cases, calcarea sulp would be a very good remedy. If we consider the mental attitude, generally they are anxious, moody, and at the same time they are having aversion to both mental and physical work. To express this disposition, Kent coined a beautiful term, real indolence. Another important adaptability we are getting in calcarea sulp, most of the complaint, even not only physical, in mental plane also, whenever anyone is suffering from any ailments requiring calcarea sulp, generally they feel good or feel better in open air. It is a deep-acting constitutional remedy, an antisoric, an antitubercular, and if given early enough, it may even prevent a malignant growth terminating in its usual way. When well-selected remedies act only a short time and the symptoms agree, this remedy is one that should be thought of along with the line of sulfur, sorinum and tuberculinum. Now we may discuss about the sphere of action of calcarea sulp. Already we have told it is curative action on suppuration, where the matter is discharging and continue to ooze after the infiltrated places have discharged. All ailments in which the process of discharge is continuing. The tendency to the formation of abscesses in the body or in any place is a strong feature of this remedy and is quite similar to pyrogen, hippursa, tuberculinum. Ruptured bowels with slow healing tendency and continuous discharge. 2 points should be remembered for calcarea sulp: slow healing tendency and continuous discharge of the yellow pus along with necrosed tissue. It is a very good and strong indication for this remedy. From pathophysiological aspect, if we consider calcarea sulp having the action especially in the connective tissue, namely collagen fibers, tendon, ligament, skin, cornea, cartilage, bone, blood vessels, intervertebral disc, etc. In this relation, I would like to elicit one important therapeutic affinity of calcarea sulp. Whenever anyone is suffering from keratitis, inflammation of cornea with discharging pus, despite of all treatment, patient was not improving. In those cases, if symptoms agree, calcarea sulp would be a very good remedy. As we are taking cases in our clinic, OPD or in our chamber, in our daily practice, as we are taking the case, as we are taking the history, in that format, if we consider any medicine, whenever we are supposed to prescribe that medicine, it will easily retrieve in our mind and simply we will prescribe it. From that aspect, now I am happy to share with you about the past medical history of calcareous sulp. Obstinate skin disease in childhood, especially if we get eruption on scalp that was very oozing in character and afterwards became scaly. Pneumonia in childhood, tuberculosis in early age, history of recurrent cold attack, rather cold tendency, cold susceptibility, suppression of skin disease, tinea infection suppression, or patient those who are still suffering from ringworm or tinea infection. All are very significant past medical history favoring calcareous sulp prescription. Apart from that, occupational history is also very important. If we go through Herring's guiding symptom in calcareous sulp in different subtopics, we will get a very good number of symptoms with mark T, that is toxicological. From that aspect, if we get any patient, those who are compelled to work with plaster of Paris, the toxicity of plaster of Paris, calcareous sulp patient may suffer a lot. So, in past history, we should consider the occupational history if we get history of working in plaster of Paris. Now, the family medical history, already I have told regarding the miasmatic background and the constitutional tendency, it is psoriatic and tubercular diathesis. So, in family we are getting obstinate skin disease, inveterate obstinate skin disease, it may be ichthyosis, psoriasis, atopic dermatitis, whatever that may be. Tinea infection in family, tuberculosis in family, and any other metabolic disorder also may favor calcareous sulp prescription. Now the general tendency. Sometimes a desire to work, to attain, to do something, as soon as he sets out to do it, the desire is gone. While working, feeling of dizziness, weakness, an oppression in head, in chest, especially if the patient like to work for a more time, vertigo may come on. Apart from that, calcareous sulp patient, those who are weak and prostrated, those who are suffering from chronic disease, commonly they may accompany with vertigo, the common feature with all ailments, especially after getting up. It may be at morning, even it may be at afternoon or evening. That is also ameliorated in open air. Almost all physical and mental symptoms relieved in open air is a very good and characteristic indication for calcareous sulp. Another general tendency is suppurating tendency, slow healing, burning and itching in both soles and does not want to be covered. As we are getting in sulfur, as we are getting in medoridum. But the peculiarity is, along with burning, there may be itching in both soles. Apart from that, calcareous sulp having strong affinity for skin affection, so the general tendency of calcareous sulp skin is dry and cracked that aggravates in winter. Generally, during case taking, considering past medical history, family medical history and general tendency, we go forward for physical genetics from appetite to sleep to bathing habit, all those symptoms. Now let me start with appetite. In calcareous sulp patient, a good number of patients may have very good appetite, rather ravenous appetite. If we go through or consult repertory, we will get under the heading increased appetite. In selected cases, they may not have any appetite, entirely wanting. Another important is subject to indigestion on the slightest provocation. Generally, whenever we are taking the case and asking about appetite, another important feature we may get from the patients, the effect of eating. In repertory also having numerous rubrics favoring this, effects of eating. Regarding effects of eating, fullness of stomach, eructation after eating. That eructation may be bitter, acrid, sour, foul. Sometimes eructation of food, water brush, heartburn. Another important characteristic feature in relation with effect of eating, especially at night, patient may feel discomfort in head, rather may suffering from headache after dinner. A distension after eating is a very common accompaniment of calcareous sulp chronic patient. Then generally we are asking about desire, aversion, etc. Regarding desire, they are having desire for sweets, fruits, cold drinks, sour things, salty things, and crave stimulants to overcome his stimulus weakness. This is the dilemma or ambiguity of homeopathic prescription. Whenever anyone is telling during case taking, he is having burning in souls, desire for sweet and salt things, hardly we can resist ourselves to prescribe medorinum without considering all those other phenomena. But we should be very cautious and particular. There may another medicine we may have. If we go through and consult Metamedica and repertory, we will get it. So calcareous sulp having desire for fruit, cold drinks, sour things, salt things and sweet. Aversion to coffee, and no appetite for meat and milk. It is written in Herring's guiding symptom, in Kent's Mathematica also. Not straightway they have written aversion to meat, but they wrote no appetite for meat and milk. Rather, patient having less interest to take meat or milk. Generally, they are very thirsty. If we consider sleep, mostly restless sleep, dreams anxious and frightful, sleepiness in the evening, but sleepless before midnight, especially after 3 a.m., and sleepless from flow of thoughts. Now we are generally asking about the bathing habit of any patients while we are taking the case. Regarding bathing habit, they like bathing in all season. At the same time, they are having tendency to take cold if they get bath in early morning. Perspiration from slight exertion, like hypersulp, but contradicts hypersulp regarding open air desire that ameliorates. Though open air desires and ameliorates, but drafts of air will aggravate his trouble. Another important thing we should remember in relation or comparison with hypersulp patient having profuse perspiration from slightest exertion, but they are very much sensitive to air, cold air, especially during winter. But calcareous sulp They are also having profuse perspiration from side exertion, but they got relief from open air, but aggravation from drafts of air and aggravation in damp cold weather. That is unlike with hypersulp. There is heat sensation internally, motion aggravates, so aversion to motion. Regarding thermal reaction, though the patient desires open air and enjoys and loves bathing, but they are very much sensitive to drafts or weather and takes cold easily, like sorinum and tuberculinum. After becoming cold, complaints common. Tendency to take cold in drafts and slight occasions from wet weather, etc. While the patient is cold in general, he often requires to be uncovered because of particular few conditions. For instance, when the calcareous sulp patient is suffering from croup or severe cough or headache, he feels an internal heat that is too much, and that is also being relieved by open air. He is very much sensitive, both cold and heat. Many symptoms are aggravated by walking, especially walking fast, becoming overheated. Generally, they do not want cover. Generally, wants to being uncovered. Aggravation from the warmth of the bed, warm room aggravates. Warm wraps that may lead to great bodily weakness. If we consider the chemical composition, calcareous sulp and hypersulp is very analogous. But whenever it was proved in human economy in different potency, few symptoms are very similar, but the modification, rather the modality and associated factors and concomitants are too much different. Another important symptom we are getting in physical genetics, like sulfur, standing aggravates. Generally, sulfur patient feels bad while standing without any physical pain or trouble. But in calcareous sulp, standing aggravates mostly joint pains. Now I am happy to share about the mind and disposition of calcareous sulp. Generally, they are absent-minded, irritable, and easily angered. In this point, one thing we should keep in mind, whenever they become angry, after anger or after vexation, they become very much weak and prostrated. Another interesting attitude is aversion to answering questions. He is easily made anxious, especially evening, during night while lying. Anxiety about the future. Anxious about his disease, especially heart disease, like calcarea sulp. Calcareous sulp having the component of calcarea. In mental sphere, we are getting anxiety of sulfur, anxiety of insanity, anxiety of heart disease, anxiety of future, like calcarea sulp. But all the symptoms are being ameliorated in the open air. He has anxiety about his salvation. He has also anxiety in the morning on awaking. They are having very changeable mood and capricious. Capricious is a very good indication in mind and disposition of calcareous sulp. Eccentric, moody, aversion to company. Confusion of mind in the morning and awaking and again in the evening, but ameliorated in the open air. Confusion of the mind after contradiction. Great despair of recovery, like Sorinum. He is discontent at all times, great sluggishness of mind, continuously in a state of apprehension, something evil will befall him, fear of death, fear of insanity, fear of misfortune, especially fear comes at night. It is very similar to Suriname. But in physical level, in thermal relation, that is very opposite. Suriname is very chilly, with despair, with fear of disease, with all the negative attitudes, they are chilly. With same negative attitude, if the patient is hurt, we may think of calcareous sulp. Another important point, if anyone give any trauma, it may be in emotional plane, in a sentimental level, calcareous sulp patient having full of hatred of those people for lifetime. If anyone do not agree with him and giving any type of mental trauma, calcareous sulp patient will carry full of hatred for that particular people, always in hurry and impatient. Generally, in extreme case, they may be indifferent and irresolution. Another important symptom in calcareous sulp, they may lament. They are having a lamenting attitude because he is not duly appreciated. Out of that, always they like to condemn other people and always telling about himself, I am not appreciated. What quality I possess, people or those who are around me, they have not recognized me in that manner. There is another important mental attitude for calcareous sulp. The malicious attitudes. Whenever he becomes melancholic, sits and meditates over imaginary misfortune, does not want to be talked to, but if any sound comes, become easily startled. Strong aversion to both mental and physical level. Already I have told, calcareous sulp revealed its reputation first in the field of homeopathy as a good medicine, having very good therapeutic action on skin. Now let me express few skin symptoms, characteristic symptoms favoring calcareous sulp. 3 points should be remembered for calcareous sulp skin symptom: burning, itching and discoloration. Burning, itching and discoloration, the 3 characteristic features of calcareous sulp patient, those who are suffering from chronic skin trouble. In acute skin trouble, in abscess and boils and all those cases, already I have elaborately discussed in my introductory part regarding the character of pus and all those things. Cracked skin. The skin is cracked after washing in winter, especially of the hands. Liver spots, pale skin, yellow skin, even to marked cases of jaundice. The eruptions are boils, burning, moist or dry eczema, herpetic pustules, scaby and scaly. This remedy cures psoriasis when the physical, mental generals and past history and family history points to the selection of the remedy. Urticaria, excoriation, intertigo. If we name, there should be a very long list. I am not supposed to make the list a very long list favoring few nomenclature of skin disease. Rather, it should be remembered, we should keep in mind the particular symptom, characteristic feature of calcareous sulp, what we are getting in our Mathematical books. Formication, itching in bed, itching, burning, itching, crawling, ameliorated by sketching. In sulfur, itching, followed by scratching, followed by burning. In calcareous sulp, itching ameliorated by scratching, sensitive skin, and the last but not the least, wounds, suppurative tendency and slow healing tendency, and oozing, necrosed tissue with pus, with blood for a prolonged time. Now I am telling about the relationship of calcareous sulp. Already we have discussed during our discourse. Calcareous sulp stands in close relation to yellow colored suppuration or discharge, specially tinged with blood and acting much along with the line of Hippo's sulp and Silicea. Regarding cough, the cough is aggravated in the evening and night, but ameliorated in the cool air, unlike Hippo's sulp, which is aggravation in dry cold air and ameliorated in damp cold. Calcareous sulp aggravation in damp cold, but acts deeper and more intensely and is often useful after Hippo has ceased to act. If given after Silicea, it will cause the abscess to heal. Sorinum, tuberculinum, bacillinum resembles with manifestation. Sometimes may also act beneficially as an intercurrent remedy. So, whenever we are treating any chronic cases requiring sorinum, requiring tuberculinum, requiring bacillinum, during course of treatment, sometimes it may happen the symptoms of calcareous sulp may evolve or manifest. And getting calcareous sulp, the treatment pathway should be more clear and straight cut. In another part, the patient, those who are treated with calcareous sulp, after getting calcareous sulp, improvement is going on, but after few months or years, no more improvement is taking place. In those cases, reconsidering the case, sorinum, tuberculinum, bacillinum, depending upon the presenting totality, will act as an intercurrent remedy which will helps a lot to the path of recovery. Thank all of you for your patient sharing. Once again, I may pay my thanks and gratitude to the organizer, especially the Homoeopathic Medical Association of India State Branch, for giving me the opportunity to say few words on the auspicious day of Dr J N Kanjilal's birthday. Thank all of you. Stay safe, stay blessed. Namaskar.